Thank you, Mayor Fuller, for joining me today. I know you've been extremely busy in trying to sort through all of the facts and figure out what's going on within the city. So can you give us a quick update on what the latest is regarding new cases and unfortunately new deaths?
I think we're recording this on Wednesday. It's Thursday, actually.
Thursday,
April
I know,
16th.
lots of days.
So I do need to timestamp when I'm saying this.
Yes.
We're really are certainly in the surge stage that all the medical experts predicted. So yesterday I reported that we had 360 positive cases here in Newton. I can actually update that today. We're now at 375, another 15 positive cases. And we now have had 25 people who are Newton residents die of COVID-19. So it's hitting us really hard.
It certainly is. Can you, I guess, a lot of these unfortunate cases and deaths have been coming from community living facilities, nursing homes, assisted living. How is that going in terms of, helping out the Falls at Cordingley Dam? I know that that's been a big issue. How have you been helping them kind of create or perhaps maintain protocols? How is that relationship going?
So Newton is home to many assisted living situations, nursing homes, congregate living settings. And as all of us do understand, those are just the kind of settings where people are in close contact with each other, where staff members are coming and going frequently to help the residents, and where you often have residents who have higher risk for, if they get COVID, having particularly severe outcomes. So we've been laser focused on those living situations right from the beginning. And yes, we are seeing particularly difficult outcomes there. And these are often people who not just happen to live in Newton, but often their family members are here. So I hear from the children or the siblings of people in these facilities, and understandably everybody's desperately worried. We have, at a local level, there's all sorts of different organizations that try to help and support these facilities. Here locally, what we do is we have a superb Health and Human Services department, and our staff members are typically in contact with these facilities at this point almost daily. Mm-hmm. And we can provide lots of advice on and protocols on how to organize themselves, have staff members interacting with them, what the residents should and should not be doing, so we can lay that out. We also, though, talk to them a lot if they are having spikes in their staff being infected. Where are there resources to support getting more staff, which is particularly difficult. Mm-hmm. And we network them with lots of different organizations and ideas who are doing that. We also help them access testing. It's really gotten significantly better just in the last week. Mm-hmm. Where most of these facilities now do have access to testing for all their residents, all their staff.
Good.
Personal protective equipment, PPE, we've all learned that new acronym. And we're also linking them. You can imagine it's called a burn rate. Their staff are burning through PPE at a very high level, because you don't want to go from one room to the next wearing the same PPE.
Right.
So a huge amount of use of it, and then we're helping link them to resupply opportunities for that. So there's a lot going on, and It's still really difficult and heartbreaking.
Well, especially for those who have passed on in those assisted living facilities, you can't go visit your family or the
Right.
one who perhaps is
Yes.
dying, which is heartbreaking for just about anyone.
Yes.
So how are the hospitals, I guess? So outside of the assisted living facilities, the hospitals are now about to hit an influx as the surge continues. How is Newton Wellesley doing? Have you had any
So
contact with them?
we stay very, very close to Newton Wellesley Hospital. Their leadership team has been very close to us all the way through. And Newton Wellesley Hospital is really well prepared for the surge. They've expanded their capacity of beds. And on a confidential basis, we are provided with their information on how many beds are filled, how many people are intubated, what's their ICU capacity, the infection rate for their staff. They stay very close to us because, again, our residents and people, particularly in these assisted living or congregate settings, typically go to Newton Wellesley. Plus, Newton Wellesley, when they take in somebody with a positive case and they improve, they're working with us to find a place for that person to be discharged to. So we're heavily involved in that side as well. And I've got to give a shout out to Newton Wellesley Hospital. The people there have been just amazing, generous with their advice, generous with in every single way, whether it's to our Health and Human Services Department, to me, to our facilities, to our residents. Real experts, proactive, amazing first line responders.
That's what I'm hearing across the country is the first line responders are really unbelievably stepping up and overly kind and helping in this situation.
Yes.
Does Newton Wellesley still have, or do they have a drive-through testing site? And does Chestnut Hill still have that going on if a resident wants to come through?
But that isn't how it works, just to make sure
tell me how that
understands. If you want to be tested, you have to pick up the phone and call your doctor, your medical provider. They still, because tests are still not in sufficient quantity, they have a whole protocol to decide if you will be tested, and then they will tell you where to go to get tested.
Gotcha.
So don't drive over to Newton Wellesley Hospital or the Chestnut Hill Mall and show up and just say, I'd like to have a test. Start with your doctor.
Start with the doctor. So if, say we don't have to get that far, a regular resident, how well is the social distancing working? I know that our numbers are going up, but they're not going up so much so maybe that the social distancing is working.
We are finding that the physical, I've switched over from social distancing to use the word physical distancing. That's the newest terminology for understandable reasons. We want people to stay close socially, just not physically. So we are finding, compared to 2, 3, 4 weeks ago, that community transmission in Newton generally is significantly down. So when we get a positive case, our health department is notified, they do what's called contact tracing. And because people really are staying home, it's much easier to do the contact tracing because people have much fewer contacts with other people. So community transmission generally is down, but we have sub-segments where we're still seeing the cases going up. We've already talked about assisted living or nursing home type settings. People who are health providers, despite doing all the best practices and wearing PPE, still are at higher risk, and we do see cases related to that.
Mhm.
We sometimes see cases where an entire family unit, a household, ends up being positive. One person brings it back. Obviously, we're in close contact with those people living with us.
Mhm.
And so we can see that type of transmission. But in general, it's really good news. Newtonians, the vast majority of us really are doing a great job of physically distancing. And if they're going out and about in public in places where they have to have physical contact, like a grocery store or
Mhm.
heading to the drugstore, uh, lots and lots of people, thankfully, are wearing the face coverings.
Mhm.
So we collectively are flattening the curve.
That's great. So I know this is a hypothetical, but when do you think the right time would be for going back to, normal, if that's even possible? And what protocols are you following to make that decision?
So I'll certainly be working closely with medical experts to help make this decision, looking closely to the guidance from the governor and the state. No individual city or town wants to do this by themselves because we are a regional community. People who live in Newton come and go from all our neighboring places, whether to work or to recreate. So we'll want to do this regionally.
Mhm.
And it's going to be complicated decision. And it does, I think, involve when do we have antiviral medications, antibody testing, tons of more testing availability to understand at any given point who actually may be infected but is asymptomatic.
Mhm.
So I think there's a lot of pieces that aren't quite in place yet. And I know all of us are anxious to try to return to some type of normalcy,
Mhm.
but I certainly don't see it in the very near future.
So the May 4th date may not actually be feasible. It's only a few weeks away now.
My crystal ball would say that's unlikely.
Mhm.
We're still in this surge um, situation right now,
Right.
but that this will be complicated to figure out when we can all be safe enough to go out. And are there certain members of our community that go out earlier than others, whether you've already had COVID or if you're of a certain age or you don't have underlying conditions that make you particularly at risk.
Mhm.
Um, and also you need the infrastructure in place. You need the transportation system
Mhm.
to be working. You need schools to be open so
Open.
that parents and caregivers
Mhm.
can
Can go
get
back.
back to their normal routine. So this is going to be tough, but we certainly hope to get back to normal
What's
when we're safe to do
what
so.
is the city doing for businesses? I know that there's the SBA loans that are available, or actually, I don't know if they're still available because so many people
Right.
have applied. But what is the city doing to help businesses either stay, continue to thrive? Because a lot of the restaurants have takeout, curbside pickup, which seems to be working for quite a few, but not necessarily all of the businesses. So, what is the city doing to help them?
So we're aggressively focusing on all sorts of different parts of our community that are hurting, whether it's elderly who are isolated. We've got a great system up now to both call them and feed them. We're reaching out to our small businesses to link them up to federal funding. And we're actively looking at, we received community development block grant funding. We're
Right.
actively looking at how to have a segment of that go to small businesses.
Hmm.
We're thinking hard about lots of people in Newton are hungry right now. Their paychecks have stopped
Right.
and they don't know how to pay for their next grocery store bill. So we've set up all sorts of systems to make sure that people can get to food, whether through our school system. The Whitson's company has been great. We've got grab and go meals going on. Our food pantries have been magnificent.
Oh, good.
All sorts of ways. So there's a lot of different places that we're leaning in hard and have already set up places. I also mentioned the Newton COVID-19 Care Fund. A tremendous amount of money has been raised.
Yes.
Anybody can go to that website, click on it, and find the application form. If you need help, please reach out. There are resources. We're trying hard, and we've got avenues for people.
So Monday was supposed to be the Boston Marathon. Obviously, that's been canceled. But I
postponed.
noticed.
Just to use the
Yes,
word.
pardon me.
For now, just postponed.
Postponed, you
Hopefully
are correct.
September 14th.
Right.
Fingers crossed.
Yes, definitely. But the residents have come up with an idea to kind of boost morale. Can you tell us what's happening on Monday to kind of bring us all together again separately?
Thank you for mentioning this. We've got, this came from a Newton resident, the idea of doing a Newton Together effort where all of us could put in our windows a Newton Together handmade colorful sign and just cheer on our neighbors and cheer on our community. We won't have the runners coming through, but
right.
let's try to spread some joy and some unity in this difficult time.
And my final question for you is, what can residents do now to help out? You did mention, how they can find help, but how can a regular Newton resident help out if they care to, either providing food for food pantries or perhaps making masks or supporting local businesses? I guess, what can the average Newton resident really just do right now?
Those are all good ideas. I support each one of them. Oddly enough, I've got to start with the most important thing each of us can do is slow the transmission of COVID-19. So rigorously, day after day after day, stay home. If you're out and about, absolutely physical distance, bring your face covering with you. If you're going near other people, put it on. But I would just add to your good list, check on your neighbors. The anxiety that everyone is feeling right now, just pick up the phone and call, use a Zoom meeting, send an email, check in. If you know anybody who could use some help with a grocery store run or a run to the drugstore, offer to go for them and leave the packages or bundles outside their door. Certainly, if you're in a position to contribute, there are so many funds out there helping our artists, our restaurant workers, our people who have been thrown out of work. And yeah, put up a sign in your window, or put a teddy bear in a window. There's a great thing going on with kids going for a walk and looking for teddy bears. And just check on your neighbors.
Perfect. Thank you very much, Mayor Fuller. And perhaps we can check in with you next week or the following week and see how things are going.
Yeah. Stay well, Jen. Hope your family is good and healthy. And
thank you. Yes, you too.
Take
Absolutely.
care.
Thank you.
Okay.